Good afternoon, my name's Kay Duffy and I'm the facilitator of the Hunter Brain Tumour Support Group, which has been running for well over 10 years now, one of the first in Australia, I'm proud to say. Before we do start on the next session though, on my own brain tumour journey, I've always been extremely gratified to find so many supportive health professionals around me. There's evidence of that here today with the people who are here giving up their time and being here to make their knowledge available to us, and I'm sure as patients we're all extremely grateful for that. Our next session is about complementary therapies. Now that's very different to alternative therapies. Complementary therapies are ways in which we can support ourselves while we're having treatment and in between treatments too. We're very fortunate to have Sharon Valks with us today. She's from the Cancer Council of New South Wales. Sharon is highly qualified and skilled in patient support services. She has special interests, I understand, in traditional Chinese medicine and acupuncture, which probably none of us know as much about as we should. So I'd welcome Sharon to the stage to give us her insight into how we can better support ourselves.
Great. Just going to get myself set up. Fantastic. Thank you. Great. First I'd like to say I would like to acknowledge the traditional owners of this land that we stand on today, the Gadigal people of the Eora Nation. I would particularly like to acknowledge the traditional bush healers, the people past and present who provided strong spiritual and social support, herbal preparations, advice on diet, rest and massage to support the spiritual well-being of their communities. I also would like to acknowledge that this is a very mixed audience. An audience of people with brain tumours, both malignant and benign, their carers and families, plus the many cancer health professionals that you've heard from today and researchers in the field, and my wonderful colleagues from the Cancer Council of New South Wales. I'm a lady that likes to use a script, so I hope you don't mind. You're going to have my undivided attention, but to stay on track, I will follow a script. Okay, integrative medicine. It takes into consideration the best of both worlds, conventional medicines and complementary medicines, and it's underpinned by clinical efficacy and sound research. It may well be the future for Australian healthcare. Integrative medicine also promotes the ideas of multidisciplinary care, which may include prevention, healthy eating and exercise. For example, a person with brain cancer experiencing anxiety might benefit from some massage or acupuncture to help them physically relax, some counselling to talk about their fears and emotions, as well as some carefully chosen herbs to reduce the side effects from cancer treatments, as well as helping with cancer prevention. Integrative oncology, like integrative medicine, also encourages a healthy lifestyle and is informed by evidence with clinical integration of complementary therapies as well as conventional medicines. It's reliant on research, skills, and the inclusion of you, the client, in a risk versus benefits discussion. Integrative oncology reaffirms the importance of the relationship between the practitioner and the patient, focusing on the whole person to achieve healing and well-being. I'd like to keep those words healing and well-being in the forefront of your thinking about this presentation. I've been asked what is complementary and alternative medicine, otherwise known as CAM, otherwise known as complementary medicines, otherwise known as complementary therapies, for more times than I can recall, and my answer seldom wavers. From my own clinical experience and education, complementary medicine is about healing and prevention. It is individualised and tailored to the whole health and well-being of the individual, and it's not an alternative to conventional care and treatment. Simply put, complementary medicine is a diverse There's multiple healthcare systems, and if you look at the slide, I really had to limit it. There were so many more elements that could have gone up there, but I really wanted to limit it because it became just a little bit too busy. They are products that are not generally considered part of conventional or orthodox medicine, but they may very well have a place. They include mind-body medicine, which uses the mind to affect physiology, biological-based practices, which uses substances found in nature and most commonly ingested, manipulative and body-based practices, physical therapies and structured exercise regimes, energy medicine, manipulating the body's own energy fields to rectify wellness, and whole health medical systems, systems of theory and practice, most often traditional, Australian Aboriginal bush healing, Ayurvedic, homeopathy, traditional Chinese medicine, and naturopathy. Complementary medicine is focused on supporting the immune system, of that there is no doubt. And as the previous speaker, Dr. Helen Wheeler, mentioned, people with brain cancers and brain tumours are living longer. Complementary therapies and cancer users, it's not just all apples and oranges. In Australia, as in the rest of the world, CAM use is very high. A study conducted in Australia in 2010 showed that 2 out of 3 people with cancer had used some form of complementary medicine. It's important to note, though, that CAM use was increased the longer the cancer diagnosis. So there is a correlation there. Now it's time to do a quick poll, and if you indulge me here, who currently uses complementary therapies in this room? I'll stick my hand up. Okay. Who is currently thinking about using complementary therapies? Okay. And who has used complementary therapies in the past? And who of the health professionals has referred to a complementary therapy practitioner? Great, thank you. This leads me to my next slide. The perceived benefits. There's a lot of stuff to think about. Let's face it. It may feel like cancer is controlling you and that your decisions are constantly being made for you in regards to your treatment. How will you manage symptoms and how will you address your quality of life? When you look at this slide, empowerment, hope, trust and acceptance are widely accepted and motivators for seeking complementary medicine. It may well be that the complementary therapist spends longer with the clients, and there's some evidence around that, and as a result creates a more therapeutic and healing environment for the client. This leads on to Australian Integrative Care Clinics, and this is really exciting stuff. If you can cast your memories back to the slide on integrative medicine, the best of both worlds, Australian Cancer Integrative Care Clinics provide compassionate, holistic care, and they are committed to delivering the best outcomes for their clients. They provide an environment of care that the public knows and trusts. They provide conventional treatments, lifestyle-based interventions, and complementary therapies. It's a really exciting forefront in healthcare. There should be more of it. I know that we have limited centres in Australia, but nonetheless, if you've got a complementary therapist practitioner and you've got a doctor working together, you can create your own self-care environment as long as your teams are working for you and communicating together. I've put this slide up as this is Solaris Care. Some people in the audience might know a little bit about Solaris Care. Solaris Care opened its doors in 2001 in Western Australia. It's a beacon of hope for integrative oncology, and over 35,000 people, that's cancer patients and carers, have benefited from an integrative approach of conventional medicines and complementary therapies. Skilled therapists provide a range of therapies, including acupuncture, counselling, meditation, massage, reflexology, healing touch, Qigong, Reiki, and so many, many more. Between 2002 and 2008, if you look at the little graph that I have on the slide, data was collected on a patient survey that was developed for patients and therapists to be informed of what they need to know. This data, or this survey, captured quality of life symptoms and symptom distress scales, including very common cancer symptoms, including pain, fatigue, nausea, bowel problems, poor breathing, appetite, poor sleep, and also disempowerment, depression, anxiety, confusion, and worry. The data on the 1,800 clients was independently reviewed, and the study revealed that Australians with cancer and their carers' outcomes are improved through an integrative approach utilising complementary therapies. It's really exciting news. It's on the forefront, and I would wager that it's where we may be going. As a complementary therapist, of course, it's how I hope to see the Australian healthcare model expand. Now, I really love this slide. It's simple and it's clear. It's also accessible, and these practices will make a difference after cancer treatment, before cancer treatment. And they will also benefit the health and well-being of the whole family. You may only be able to achieve 2 or 3 or 4 at a time, and if you have a look at it, let's be lean and not underweight, let's be physically active, have a healthy diet, moderate your alcohol intake, limit your red meat, avoid processed meats, limit your sugar, limit your salts. These are many things that, as an audience, you've heard of in the public health arena for a very long time. They're great recommendations. They're supported by the World Cancer Research Fund International, is globally supported by cancer NGOs, who are all dedicated to prevention and the control of cancer by means of healthy food, nutrition, physical activity and body weight. Small steps in changing your diet and your lifestyle will impact on how you feel, enable you to become a more active participant in your own healthcare. Now, this is a really fabulous slide. For the purposes of description, it's called Snake Oil or Scientific Evidence for People Health Supplements, for popular health supplements. This slide represents condition-specific levels of evidence of complementary medicines that are ingestive therapies, and this is looking at the data in 2011. The left-hand side of the slide depicts all conditions and levels of evidence, and the right-hand side has been reduced specific to cancer. For example, on the left-hand side, there is a good level of evidence that fish oil helps cardiovascular disease, and on the right-hand side, that fish oil is promising with regard to improving cancer symptoms. Now, if you actually have a look at the body of bubbles on the left-hand side versus the body of bubbles on the right-hand side, and you can imagine that your oncologist and your doctor, who's a lot more informed than a person like me standing up here, this can help explain why your oncologist or your doctor might be reserved in their recommendations. And additionally, why it's really important that you communicate and seek expert advice regarding the best support for you. Therapies and stress management. Symptom management and cancer and complementary therapies in brief. How does it work? Now, there's a lot of information again on this slide, and this is just one paper I pulled out in relation to palliative care and cancer symptom management in relation to complementary therapies. There's a lot of research that I haven't put up on the screen that's informing these answers, and I'm just going to touch on a few of them now. Acupuncture, therapeutic touch, hypnosis for cancer pain. During hypnosis, a person may be guided to have a different subjective experience of pain, altering perception and sensation. During acupuncture, inflammation and congestion may be interrupted, promoting the movement of qi and blood in and out of an area to promote an analgesic response. Therapeutic touch may interrupt the cycle of distress and reduce swelling and spasms. That all has an impact on cancer pain. Acupuncture and massage and cancer fatigue. Both acupuncture and massage facilitate calm and have a soothing effect on the body. Mind connection, which helps reduce tiredness, and reducing tiredness has a known impact on reducing cancer fatigue. Mindfulness-based stress reduction programs, including transcendental meditation, which I know absolutely nothing about, but it was up there, has an impact on depressed mood and anxiety. Meditation and other relaxation techniques, which are easily practiced in your own home, enable people to gain control and awareness of their emotions, and that impacts mood. Many of these symptoms are common in cancer patients, and they can be addressed by integrating complementary therapies into your conventional care. Complementary therapies to help reduce distress. There's no doubt that the emotional distress, that cancer has a significant emotional distress and it can impact daily living, disrupt our mood, affect our overall ability to cope with cancer and live in our lives. People who experience chronic stress are also more prone to viral infections such as flu or common cold, and they may have headaches, sleep troubles, depression and anxiety. Some complementary therapy techniques, and I've put a few up on the slide there that you can read at your own leisure, including yoga, Qigong and Tai Chi, create a physical and emotional stability in the body that may help to reduce stress and will therefore help to reduce cancer distress. Another busy slide. This is a systematic review of acupuncture and cancer care. Now, just in case anyone in the room doesn't know what acupuncture is, it's part of traditional Chinese medicine. And it's the part of traditional Chinese medicine that utilises sterile needles into specific acupuncture points on the body that belong to organ systems and meridians that cover the entire body. I've put the little image up of the head there just so you can actually have an indication, just even on the brain and head, on the head and neck, how many acupuncture points there are. So acupuncture is a powerful tool for general pain. And there's also some studies that it has some use in cancer-related pain and in reducing the reliance on pain conventional medications. Now that's really positive news. Managing pain assists in improved quality of life and reducing unwanted mood swings. This systematic review looked at over 2,000 publications and also 41 randomised controlled trials. And so that's evidence and efficacy. They're peer-reviewed journals and they're also high-quality randomised controlled trials. The conclusion was that acupuncture as an adjunctive treatment to chemo-induced I'll say that again, that acupuncture was appropriate as an adjunctive treatment for chemo-induced nausea and vomiting. The outcomes also noted that additional studies and research had to happen. There's no doubt about it. We're really only in the beginning of integrating complementary therapies into cancer management, but it's really promising news. Medical Qigong. This is a really lovely slide, and it makes me feel better in my being just saying the word medical Qigong. Why? Because Qigong is one of the oldest stems of traditional Chinese medicine, so it's more than 2,000 years old, and the people are still practicing it today. You may well have been out into the park and seen some beautiful older Chinese people or Western people out there in the parks under the trees in the early hours of the morning practicing their Qigong. It's a gentle exercise. It involves relaxation, visualization, mindfulness. And what it actually does, it utilises the forces of yin and yang, which are concepts in traditional Chinese medicine, and it subtly directs these through the visualisation and through the gentle movements to enable the body to find balance. Now that all sounds very esoteric. However, in 2007 and between 2000 and 2008, there was actually a small randomised controlled trial that took place in the University of Sydney on a Cancer Research Fund grant. So this is pretty exciting stuff. It was the first of its kind in the world. 81 cancer patients were recruited to look at the impacts of medical Qigong on cancer. Over 10 weeks, measures were used to look at quality of life, including fatigue and inflammation. And why inflammation was important is that inflammation is a strong predictor in survivorship in cancer patients. The health benefits of these patients are outlined, and they do warrant further investigation. The health benefits in the 81 clients were noticed as improved qi flow to reduce stress, improves cancer-related cognitive function, quality of life, impact on inflammation. However, once again, further studies are needed to validate these results. Yoga. Now, I practice yoga 3 mornings a week. It means getting out of bed at 5:45 a.m, which is often rather disruptive to my partner, but nonetheless, it does make a difference to me. So, standing here today, I couldn't not talk about yoga as a form of complementary therapy. Yoga is an ancient Eastern tradition. It's a way of living. It's non-harm in action and words. So it's a philosophy. Through the focused breathing and meditation and controlled movements, yoga may be deemed effective for managing many cancer-related symptoms. And some of the health benefits in the cancer group of the study that I put up that have been noted were improved sleep, mood, and reduced anxiety, improved body image. And the body image might very well come about by your ability to actually be strong in your own body. And I would wager that would have a very positive effect on your own sense of well-being. Also improved pain management, and pranayama, which is the breathing technique, one of the practices of yoga, was successful in increasing immune function. Massage and therapeutic touch. We couldn't talk about complementary therapies without talking about massage. The slide almost speaks for itself. Massage and therapeutic touch feel good, and most people would agree. However, what's the evidence? Therapeutic touch from a friend or a carer and or a massage professional delivered with intent, with communicating care, can promote relaxation, reduce stress, and improve mood. That's just fantastic. In brief, massage therapy counteracts many of the negative and physical, emotional symptoms experienced by cancer patients and their carers. The goals of an oncology-trained massage therapist include improving the patient's sleep, decreasing pain and stress, and decreasing any disruptions of the patient's normal role in life. Improvements in quality of life for people with cancer can be experienced by including the simple techniques of therapeutic touch or massage into their health care regime. Herbal therapies, East and West. Now look, herbal medicines are the most hotly debated part of cancer care by complementary medicine, and I don't protest to sway away from this position. However, there are some promising products and studies looking at the integration of herbal medicines into cancer care management. In the newly emerging Society of Integrative Oncology in Australia, one of the mission statements recognises evidence-based treatments, including herbal botanicals, diet and nutraceuticals. Now, I think we're a long way off. This is a very new and emerging standard of care, but nonetheless, there may well be a place for herbal medicine and diet and supplements in cancer management. I would like to say, though, and it's very important to say, that any discussions around any ingestive therapies need to happen in conjunction with your healthcare team. It's really essential to keep everyone on the same page. I'd also like to note that in terms of modern day practice of naturopathy, traditional Chinese medicine, and many of the other whole health systems, there is a recognition that it's important to have evidence-based herbal therapy practice. So there's a whole other body of research happening in complementary therapies that may well have some value in cancer management. This leads on really well to the slide. So keeping your health care professionals in the loop. Let me start by saying the number one reason to keep your health care professionals informed is that they want the best health outcomes for you. That's without a doubt. All the speakers today have been very inspiring. And from the position, I feel very humbled to stand up here and talk to you in the light of such a revered group of health professionals. Open disclosure will reduce risks. It will improve efficacy of incorporating these new therapies into your cancer management and enable your healthcare team to track positive outcomes. And if you're talking to your healthcare professionals about your complementary therapies, it gives you one less thing to worry about. Could I ask for a show of hands of all the carers and family members here today of people with cancer? Welcome. This slide is for you. Families share our decisions. They support us when we need it. They provide us wisdom, insight, knowledge, care and love. Research has shown that complementary therapies can have a positive impact on the whole health of the family. However, treatments that are costly and promise cures can cause stress, on people that care the most about us. This slide is a reminder that it's important to keep your families in the loop, and it's important to have discussion with your family about integrating complementary therapies, particularly if it's a really rigid dietary regime that's going to upset the entire family and cause an extra burden and stress. Small steps. Okay. This slide is just simply, I've got no colour preferentials here, but I've got the client on the left and the health professionals, including complementary therapists, on the right. So we're just trying to avoid self-prescribing, panacea claims, and hopefully receiving respect and non-judgment. I'm going to wrap this up very soon, but I would like to draw your attention to the World Health Organization has a checklist and guidelines for you to consider when exploring the world of complementary therapies. Additionally, in your handout, your goodie bag today, you would have received this little booklet here, Understanding Complementary Therapies by the New South Wales Cancer Council. One of the main questions to ask if you're considering incorporating complementary therapies into your cancer management is, are you willing to work with my doctors or other health professionals I may need to see? If it's no, then it's no. That's as simple as that. You don't need more stress, you need a team of people that are working with you and working for you. Now, this is from the Neurological Foundation of New Zealand. It's just absolutely gorgeous, and I like number one. It says eat dark chocolate. And note to self, eat dark chocolate in moderation to help improve brain health. What's the reason? Okay, well, this was from an evidence-based website, okay? When you eat dark chocolate, you activate the systems in your brain that pump dopamine, an important brain chemical. These systems enable learning and memory and may help keep your brain sharp and fit. I put the link there, and I won't go through all of them, but I think it's really, really wonderful because there's some great activities up there, and certainly they're accessible to most people, and I'd say they bring a smile to anybody. My colleagues today from the New South Wales Cancer Council, Lorna O'Brien, the manager of the helpline, and Emma Ryan, who's the pro bono case manager for New South Wales and ACT, are going to talk more about cancer information and support services. But this slide is just here, just so that you can see in terms of programs and services at the Cancer Council, patient, carer and family are in the centre, that we make our decisions and our programs are developed and informed by you, the person with cancer, and through the 19,500 calls that the helpline receives annually. I should just check, how am I going for time?
We're 15 minutes over time.
Are we?
Yes, but not your presentation.
Oh, okay.
But I'm concerned about lunch, perhaps.
Okay. Well, look, I could, what I might do is I might end with the slide, because it really is a beautiful slide, and to talk about complementary therapies and cancer distress and symptom management and anxiety and all the quality of life markers, and not mention mindfulness and relaxation techniques would be an absolute failing. But short of me being able to say everything I need to say about it, I love a handout. And you've got these two resources in your goodie bags today. One is a relaxation and one is a mindfulness meditation. Now, I've listened to both and I've utilised both. They have a different level of appeal, but they both generate the same response. They really are very soothing and very calming. So, mindfulness and relaxation. Neuroscience suggests that daily positive affirmations, including mindfulness and relaxations, has a beneficial effect on the brain. That's really great news. Mindfulness also helps reduce the allostatic load. And what I mean by the allostatic load, I mean it refers to that wear and tear on the body that results from either too much stress or the inefficient management of stress. A high allostatic load leads to accelerated ageing, immune suppression, increased inflammation, atrophy of brain neurons. None of these are positive things. However, mindfulness and meditation is easy to learn. Relaxation is easy to learn. For some people, relaxation may very well be going out into the garden and spending some time by putting your hands in the earth. It's about creating a quiet space. It's about taking some time out for yourself. And it's about going inside, monitoring your breath, and just finding a space to be. I think that's probably a perfect point to end so that everyone can have some lunch. And thank you very much.